Thanks so much. I'm happy to report that actually all of our COVID-19 indicators are actually on the decline, which I think was a very welcome and unexpected surprise, at least for me. Of course, we need to be careful. I'm cautiously optimistic that this surge, which we expected to be muted, given the high levels of vaccination and the high level of natural immunity from our Omicron surge. But right now, our case counts, they're still high at almost 600 cases over the last week, but they're trending down. Our hospitalizations are at 27, but our new hospitalizations are at 17. And so that's a little bit lower than the last 2 weeks. Our wastewater surveillance, our syndromic surveillance are all trending in the right direction. So I'm cautiously optimistic that this has been a muted peak, a muted surge, but of course, COVID has continued to surprise us every step of the way. So what I can say is that this week's indicators consistently show that we are trending in the right direction, but we'll see what the Memorial Day weekend has done to our infection rates. And then the other news, I know several of you were at our hepatitis A vaccine event yesterday. We continue to have hepatitis A in our community. We currently stand at 60 cases of hepatitis A in 2022. But if we look at where we are over the last year, if we look at starting in September, we're at 123 cases and 81 hospitalizations. I'm very pleased to report that yesterday we had a successful event focusing on our restaurant workers, and we had over 50 restaurant workers come and get vaccinated. So that's really great news. So that's the update. It's short and sweet today, and I'm happy to take any questions that you may have. I see some, let me open the chat. Okay, that's a recording issue, I think, for Christy.
Yes, I'm not aware of any top line recording to turn on, but organizations have been able to record it in the past.
Okay. Jacob, are you all set? Do you need me to repeat anything?
As of right now, I don't believe that it's been fixed. I will try to ask one of the people here that is recording. Maybe I can steal their video footage a little bit later, but for whatever reason, it's just not working for me. So I apologize for the issue.
Oh, no worries at all. All right. Any questions from anyone?
Hey, Dr. Morrow, it's Leanna Scacchetti with WDBJ7. This brief, surge, if we can call it brief, that we have seen was somewhat predicted based on watching what was happening in the United Kingdom. So it wasn't necessarily a surprise that it was going to happen. As far as what we're projecting, or maybe what the CDC is projecting, looking at what's happening elsewhere, globally, is there anything else on the horizon as far as COVID that we should be paying attention to?
I'm always hesitant. That's a great question, Leanna. I'm always hesitant to say what lies ahead of us, just because COVID-19 has been so unpredictable. I know I've said this in the past, influenza is predictably unpredictable. And COVID-19 has been unpredictably unpredictable. So last year, we really thought that behind Delta, we didn't have much going on. And then Omicron just really gave us a wallop. I mean, that was an incredible surge that we really weren't expecting, the global I think that just happened so quickly. So I think we really have to have humility when it comes to this virus, and know that it is just unpredictably unpredictable. That being said, I think that right now the indicators are looking pretty good. I always feel like I have to throw this big disclaimer out that we still have a lot of active disease. Roanoke City, Roanoke County, Covington are all still in at moderate community levels, in yellow. But the trends right now are in our favor. And when I talk about trends, I'm looking at the cases, I'm looking at influenza-like illness surveillance, looking at our wastewater surveillance programs, looking at our hospitalizations. And everything right now looks like it's trending down. So that's great news. But I can't possibly say what's going to happen in July. Initially, we were thinking that the surge would continue and maybe peak in July, and it looks like it's going to have peaked earlier than that. But again, next week something may change. So at this point, I'm cautiously optimistic that we're trending in the right direction for the summer. We do have to see if the Memorial Day holidays and people gathering had any, has had an impact. Hopefully not.
And could you reiterate which areas of the health district are considered what the transmission level is, whether it's moderate or high? Could you just reiterate that?
Yeah, so right now we don't have any in high transmission, which a couple of weeks ago, we had several of our jurisdictions in high transmission in red. So Roanoke City, Roanoke County, I'm so sorry, Roanoke City, Roanoke County, and Covington City are all in moderate levels in yellow. And the rest are all in
Thank you.
Sure, absolutely. Jean has a question about hepatitis A. For those who work in an eatery where a worker had hepatitis A, should they get vaccinated? We strongly encourage that any coworker of someone at a food establishment who has tested positive for hepatitis A, who has hepatitis A, get vaccinated. So we've been, for any restaurant that we've identified a worker that's had hepatitis A, we've done direct outreach with that restaurant and offered vaccine on site. In my ideal world, we would have 100% vaccination rates of restaurants where there's a worker who's been identified as having hepatitis A, because if there's any shared meals between the workers, if there's any other potential exposure between the workers, it's really important for us to ensure that all of those workers are vaccinated. So we work really closely with the management of those facilities to make sure that they're encouraging their workers to get vaccinated. And so far, we've had wonderful cooperation from all of the establishments that have been impacted by hepatitis A in food establishment workers. Oh, and sorry, I missed Salem. Thanks, Christy. So Jean, did that answer your question? Hopefully that did. And so, the event yesterday was for all restaurant workers. We think that because we're in an outbreak, we want to encourage all restaurant workers, all food establishment workers to get vaccinated. But we are particularly concentrating our efforts in restaurants where there's been a worker who's been identified as having hepatitis A. With individuals who who consumed food at a restaurant where a worker was identified with hepatitis A, we have been encouraging people to get vaccinated. Now, thankfully, in the last two situations, it does look like it's an extremely low risk situation. But given the sensitivity in our community, given what our community is experiencing, we're still encouraging people to get vaccinated, and they can certainly contact us. If they have insurance, they're encouraged to go to their primary care providers or to a pharmacy, but certainly they can contact us if they've eaten at a restaurant. Now, we have a 2-week window of opportunity to prevent hepatitis A. Once that 2-week window of exposure is passed, it's not necessarily preventing hepatitis from that exposure, but we still recommend that people get vaccinated.
Dr. Morrow, Leanna, again, if I may, a couple of questions from viewers as it relates back to COVID, talking about
Sure.
additional booster vaccines and then also oral medication. Our viewer Sue had a question about when will the oral medication be available for all folks testing positive for COVID? I think a couple months ago, we had talked about how the CDC was working to try and let doctors know that there was a pill that was available, more available than it had been. Are you able to talk to us a little bit about booster additional vaccine development for younger children, and then also maybe the uptake for that for any oral medications associated with treating COVID?
Sure. So with respect to boosters, certainly, we're encouraging people who want to get their fourth dose, their booster, to go ahead and get it. We still have moderate levels of activity in 4 of our jurisdictions. In terms, so certainly anybody who's eligible for a booster, we encourage them to get their booster. In our family, we all got our boosters in the last few weeks when activity started increasing. With respect to children, we, under the age of 5, so 6 months to 5 years, we are expecting that there'll be a ruling on that, recommendations on that next week. But of course, as happened earlier this spring, we have to wait until that recommendation from the FDA, the Food and Drug Administration, then the Centers for Disease Control Advisory Committee on Immunization Practices, and then Virginia Department of Health before we can start administering that vaccine. And we thought that that was going to happen earlier in the spring, and the FDA was doing its due diligence and delayed that until there was more evidence. We are expecting that it will be approved next week. But we have to wait for that process to unfold so that we can all feel very secure that the decision that was made was based on the best available information, and that the FDA and the CDC have deemed the vaccine to be safe and effective, which I'm confident that it will be, but we must let that procedure, that process unfold without any pressure. So assuming that that happens, assuming that all of those levels of recommendation go through, we're anticipating that children, parents of children under the age of 5 who would like to get their children vaccinated will have that opportunity either through their doctor's offices, through pharmacies, or through us next week. With respect to the antivirals, I think it's really important for us to think about that these are therapeutics, and most decisions need to be made, decisions like this really need to be made in conjunction with your healthcare professional. So right now, oral antivirals, as well as the monoclonal antibodies for people who are at high risk for progression of COVID-19 to severe disease hospitalization, they should talk with their healthcare providers to see if which of the medications, if one of the medications is best for them. People who are at low risk low risk meaning that they're healthy, they're having mild symptoms, do not necessarily need to get an antiviral. And that's really why it's important for anyone who's interested in one of the therapeutics to talk with their healthcare professional to make sure that they're making the right decision for that individual. We, in public health, we tend to talk about what we know is the recommendation for the entire population rather than individual clinical decision making, which is best done with the provider and the patient. So I don't know if that answered the viewer's question, but the bottom line is antivirals, monoclonal antibodies are available. People who need to access them should work through their doctor.
Thank you.
You're welcome. All right, I'm not seeing any other questions in the chat. I'll just wait a moment to see if there are any last questions. All right. Well, hopefully we're going to continue to see this downward trend. I am cautiously optimistic, and thank you all for continuing to help us, partner with us to get good information to our public. Thank you.
Thank you all for joining us. I'll get the data sheet out to you shortly. Thanks again. Take care.